Hi, I'm Dr. Joanne Smith.
And I'm Dr. Corinda Hankins, and this is a pod full of pediatrics.
Subscribe here for more content.
Or you can go to our website at onecommunityhealth.org.
Or follow us on social media at One Community Gorge.
And this is the one where we talk about newborns.
And newborns itself could be many, many podcasts.
Yes.
Because there's just so much to say about babies. We're going to just limit it to some of the fine points and not get into too much detail about the big stuff.
And the big thing is that if you do have questions about this, go talk to your primary care provider because they do have all this information and they can talk you through it. I think one of the hardest things about newborns is that you prepare all this time during pregnancy and right.
Then
you walk in and you're still, everything is crazy, right? Like
yes.
We have this newborn plan. Even often you'll have like this birth plan, which babies don't read.
No,
so
yes.
they don't follow a birth plan.
Like it's great to have that idea, but the baby doesn't know your plan. They
yes.
haven't signed on for that. They
yeah.
haven't signed that contract,
and
so they're doing their own plan.
So much of it changes like as you first get happen, and that's okay.
Yes.
Like that's what's supposed to happen. That's why you go in. That's why you are in the hospital and to have your baby, because people there are used to those things happening.
Used to things not being predictable.
That's right.
How babies are. They're
yeah.
not 100% predictable.
And so this one, we kind of talked through a little bit about what happens to your baby right after they're born and
yeah.
what to expect, and then also about what to expect like in those first few days and weeks that you're home. And so that's really what we're talking about when we talk about newborn care.
So after the baby's born, and as long as no resuscitation was needed, they will wrap that baby up and get them to you as fast as you can. And babies love to be warm and snuggly. So that is where they're the most comfortable, is right up next to you, right from the beginning.
Then they're going to take the baby back for a second, and they're going to do things like weigh them and measure them, make sure their head circumference
is
normal.
Up a little bit.
Clean them up a little bit.
A little bit messy at the beginning.
They do look a little yucky as they first come out. And they aren't going to bathe the baby. In fact, now they kind of wait on bathing the baby again to try to keep some of that heat in. But they will kind of wash them off or move them off, like get all the gunk off a little bit.
Yes.
Yeah.
And then they're going to do some things to help keep your baby safe. So the first thing that they typically will do is a vitamin K injection. So vitamin K is a fat-soluble vitamin, so that means your body cannot make it. The sources of vitamin K for the baby are from the mom, right? And placenta does not have great transfer of vitamin K.
No.
And so that baby at the beginning is higher risk for bleeding because vitamin K is the thing that helps us make clotting factors in our body. Babies are at risk for something called hemorrhagic disease of the newborn, which is as terrible as it sounds.
It is. And it causes bleeding in specific places, but the places that they have bleeding are bad, like your brain.
And the highest risk time is at birth when that baby's vitamin K is not substantial at all, but it can happen up to 8 months of life. So we like to make sure that that's not going to happen by giving the baby an injection of vitamin K right from the start.
Right, and the reason we do injection is that it actually is better than oral. There are some oral vitamin K options, but they don't get absorbed as well, especially in a newborn gut. The other one we talk about is erythromycin ointment.
Right, which is eye ointment, which we use for older kids or like pink eye or some kind of eye infections. And we give it to all newborns because they've just come from a place that's not the cleanest place, let's say that. I mean, it's normal bacteria, it's natural, but still.
Yeah, it is the vaginal canal, and it's not super clean. Yeah. It's bacteria that we typically associate with sexually transmitted infection, which yes, we check for early in pregnancy, but we don't always find, or it can develop later. And then also just other bacteria, which is actually not so great for baby eyes sometimes. Yes. But the important one is chlamydia and gonorrhea, because chlamydia and gonorrhea, if you do not treat it or don't prophylactically avoid it, basically, which is what the eye ointment does, and you do have one of those, you can have something called neonatal ophthalmatoryum, which is a horrible name, but
yes.
It is actually a really horrible disease.
And it was a leading cause of blindness for babies until the practice, which was about in the 1880s, came about when they started routinely treating babies' eyes as prevention so they would not get infection in their eyes.
And I didn't realize it was that long ago.
Silver
right?
nitrate, which I can't even imagine how irritating that was on their eyes.
And that was super irritating, but it actually worked and prevented the major cause of blindness at that time.
Yes, and now we use something that's way less irritating.
Yes.
So we definitely recommend you do it.
And so really a great prophylactic medicine to prevent something really bad.
Yes.
And no real reason not to do it. We're also going to talk about two sort of vaccines that you get or that we recommend. But we're not going to talk about them in detail here because there's, again, so much just to talk about in the newborn period, and because we are doing the vaccines sort of separately.
Yes.
And that's hepatitis B vaccine, which is a very good vaccine. Again, which I think we mentioned in the episode previously, really no side effects from that one. Like there's no fever. It's really easily given, and it works great.
Really well.
And it works great for, again, preventing hepatitis B if mom is infected.
And then the RSV prophylaxis, which again is not a vaccine, but it's a medication that's given through injection to prevent RSV. But
and
again,
it's antibodies that we give, right? And that actually can be very helpful. And that's only given during the winter season if you have a baby sort of born in a time, again, that RSV is going to be predominant.
So the other things we're looking at with newborns is bilirubin. So bilirubin is what makes baby's skin look yellow, and it's a normal physiologic thing for babies to all get a little jaundice in the first few days, and the jaundice makes them sometimes sleepy, hard to feed, but the real risk if it goes too high, it can cause brain damage. So we're monitoring it very careful in that first week.
Yeah, and bilirubin is really a breakdown product because babies have a lot of blood cells because their lungs didn't work as well. Or they didn't work.
They didn't work at all.
Yeah,
they didn't use their lungs. Before they're born, they don't use their lungs at all because they're not breathing air.
Nope.
And then they come out and they're like, wow, I got to use my lungs really fast. And then they have this high hemoglobin, which is the part that carries iron, and they break it down into bilirubin, and that's a side product that they have to get rid of.
And their liver, which is what helps us get rid of that bilirubin, actually isn't working that great at that time.
I mean, they're very new.
They're
right?
new.
They have to
Nothing's working perfectly.
Yes, they're learning how to do these things.
And so that's why the bilirubin can build up. And there are different ways to make the bilirubin go down. A lot is just feeding and making sure that they're feeding well and pooping. And then the other one is if it does get too high, they can do a light therapy, which is like their own little tiny tanning bed, but not as bad as tanning beds.
They wear these really cute little sunglasses.
And they wear these cute little sunglasses.
So umbilical cord, that's the part that connects you to mom, that is tied at the beginning, and then
that was providing all that oxygen.
It was. That's how we could skip their lungs.
That's
and right. It was. It depends on the baby how big that is and how long it is. Depends on how close it got cut. But really, you just try to leave it alone for the most part. Like you're not going to put that baby in a bath where they're submerged until that cord falls off because it's a direct line into the heart.
And that's because now we actually treat the umbilical cord with things that actually kind of can protect against it becoming bacterially infected, because it actually connects to everything inside, right?
Exactly.
So until that falls off and the connection is cut completely, we really don't want anything to do it. And so they actually treat it. You don't really have to do any cleaning for it. You can clean off around the edge. Again, the umbilical cord has no sensation.
Nope.
So it doesn't hurt the baby to do that. I know parents are really scared to move it, but you don't need to be.
No, just keep it out of the diaper, and you don't have to touch it, but you can clean it off if it seems kind of like it's getting stuck.
Yeah, and then it does usually fall off in 10 to 14 days. So
yes.
You want it kind of off by that 2-week mark. So.
Newborn screening is something else that's done routinely in all of the states in the U.S. And I just moved here from Indiana. In Indiana, the same conditions are screened for, and they're all inborn errors of metabolism or inherited conditions that we know if we screen for as babies and find out, it can change what we do next in terms of their feeding or medication and actually prevent illness.
These are things that if we know ahead of time that they're there, we actually can make a huge difference in how that disease progresses. So I always like to talk about the hypothyroidism because it's really where their thyroid isn't working well. And so there are some congenital hypothyroid cases where that happens right from birth, right? And if you can recognize that and put them on the Synthroid, which is the thyroid medicine, it actually, you can prevent every side effect that can happen with congenital hypothyroidism,
crazy, right?
Which was all of this severe developmental delay.
Before we could screen for them. And these used to be called the PKU tests by a lot of states because that's kind of where this test first started, was screening for phenylketonuria, which I always just on the Diet Coke can, it says, if you have PKU, don't drink this. And I always was like, before I was in medicine, what is that? Well, it's an inborn error of metabolism that has some diet restrictions. And again, if you know from the start, then you don't end up having any problems.
You don't have problems. But if you don't know, if you don't know, like they actually have severe, again, developmental delays and cognitive problems. And so this is really important. And the newborn screen, again, it's a little poke where they fill up these little circles with some blood. But babies are not going to remember it.
No.
And it actually will tell you so much about your newborn. And so now we're going to talk about, you usually go home, right?
Usually you go home.
Yeah.
Yes, you definitely go home.
You definitely go home. And now we go home a lot earlier than we used to. Like,
Yes.
you know, like 50 years ago, they stayed in the hospital a long time after
2
birth.
weeks. Yeah.
Yeah, you don't have that anymore.
No.
So you usually go home within 24 to 48 hours after vaginal delivery and within like 72 hours after a C-section.
And you have a very surreal feeling the first drive home from the hospital because you're in the car and you look back there and there's a baby and you're like, oh my gosh, do they know that they gave me this baby? It just feels so weird. Like even though you knew the baby was coming, it's just so weird.
Well, and
to
I
have
always
an extra person.
I found it funny because, you know, we like had gone through pediatric residency. I was totally prepared to have a baby, right? And yet I still got that same feeling.
Right,
like,
absolutely.
am I supposed to take this baby
Is this
home?
really
Like,
mine?
is this mine? Can I do this?
Who let me do this, right? But
Shouldn't I have to pass a test?
This is totally normal to feel that way. Just the first time you're like, wow, I have a responsibility for another human being.
Yes.
Right?
Complete responsibility.
Yes. And you know what my husband and I always laugh about is that like you set normal for that kid, right? So you have to be like conscious about like, okay, I can't do too many weird things around them. Otherwise they think those weird things are normal, right? So you have to be more conscious as a person.
Before you leave the hospital, you should have an appointment with your follow-up, your pediatrician or your family practice doctor or your practitioner. And the exact timing of that will really depend on what happened in the hospital. And then at home after discharge, the thing that you will care the most about, that your baby will care the most about, is feeding.
Absolutely. So every 2 to 3 hours, that baby needs to eat. And part of that is their blood sugar drops, and really between 3 and 4 hours of blood sugar drops, and then it's harder to get them to feed. So you really want to get them to eat every 2 to 3 hours. Some of that is they're going to raise their hand and be like, feed me. Some of that is going to be sleepy, and you're like, come on, wake up, let's eat.
So a lot of times they're not eating a ton at any one time, but that means they have to eat frequently. And so really when you're breastfeeding, it's going to be every 2 hours, and you're going to have to wake the baby to eat sometimes, and that's okay. It's okay to wake a baby to feed. And I always talk about this because while all babies' weight drops a little after they discharge.
And that's expected and normal.
Yep, and that's somewhat just because they have a lot of extra fluid because they were in this huge sack of fluid, and so now they're going to get rid of that, and so they lose that weight, and they have to have time to kind of catch it back up. But the important part is that if you do lose all that weight, you can get pretty sleepy.
Mm-hmm.
And so often babies who weight is down a lot can actually seem like they're not hungry, or I call it the like using mommy as a pacifier.
Uh-huh.
So they kind of like they do the little suck and then they fall asleep. Suck
Right.
and
They're
fall
just
asleep.
hanging out. They're not really working.
They're not getting any nutritive
No.
feeding there, right? So, and that's unfortunate because what it means is that you're thinking that this baby's on your breast for like 45 minutes and that they're eating really well. And in fact, they aren't actually
They're just hanging out.
They aren't getting much food. And so my favorite thing to say is that you must feed the baby.
And my favorite thing to say is, well-fed babies feed well, right? So sometimes you have to prop them up, pump some breast milk, offer some formula to get them, a little bit better fed so that they'll come back and breastfeed with more energy, that they're not too tired.
Exactly. And you will find this, that like the closer they get back to birth weight, the better they eat. They have more energy.
Now.
They're feeling better. All of that is really improved. And so feeding the baby works.
Absolutely.
It really does.
And offering a bottle in the beginning is totally fine if you need to do it. And again, it's based on that weight loss, based on the birth weight of the baby, because sometimes really tiny babies have a hard time eating enough based on the jaundice. And at the beginning, they have no memory. So anything you do, it's going to be fine.
Yeah, like we all recommend that we breastfeed babies, and that we can try to do that as long as we can, as long as possible. However, what I also tell parents and all of this is that we do have options and supplements when that isn't working. Right. And I always think it's so funny, like on all the TV shows, and they are made up, I know that, but still.
I'm glad you know that.
That's but still it's horrible when like they have this baby and it's this beautiful thing and they go and they breastfeed right away.
Right,
and
it goes perfectly. That's not really how it happens.
It never happens. I feel like the chance of that happening is so much smaller, especially with your first child. And so it's really not a thing that you should expect.
Babies have no memory. Sometimes you have these amazing feeds and like, yeah, we got it. it, and then you have this feed where you're like, what happened?
That's right.
They don't remember.
And it's hard, like figuring out how to move your body and get in the right position.
I was always squirting my babies in the face, and you're like, I'm so sorry, right? Like, it's just, there's a lot of things happening. And I think there's some personality to breastfeeding too. Like, my first baby was easy to breastfeed, and I was like, why doesn't everybody do this? And then I had another baby, and I'm like, this is why not everybody does this. Personality matters. Sometimes the baby has a different agenda. They did not read the book.
Yeah.
And you're like, wow, this
Right.
is a lot of work.
But the thing that I always tell parents too is that you have so many things that you will feel guilty about with your children. Don't feel guilty about feeding. Seriously.
Right.
Like there's like a whole lifetime of guilt that you'll have, right?
Mostly you though.
I know, mostly I do have a lot of guilt. But the thing is that with that, this is not something you should feel guilty about, right?
No.
If breastfeeding isn't going well, again, feed the baby.
Yes.
So give them what they need to thrive, which might be pumped breast milk,
or it could be a formula, but it just needs to be a formula that is a standard formula. 20 calories an ounce with iron supplementing there. And our formulas in the U.S. are very well studied. I mean, they have been through a lot of evaluation, and I think last year they formed another committee to start evaluating them even more closely, because we want to make sure what we're feeding babies is safe.
Right. And checking to make sure, because sometimes they are manufactured in places that can have, and they have had issues with formulas because of where they were manufactured. And again, they catch those things, tell people, take them off the market, and reformulate and or redesign their systems for making them. But that is why, one of the reasons they are safe. It is really important to recognize that a lot of the things that we have in formula are there because they're like what's in our breast milk.
Right. They are really trying to recreate breast milk. I mean, they've done a lot of analysis of breast milk to get all the different parts there, and they've tried to recreate that in formula. It'll never be perfect because breast milk is amazing, but we're going as close as we can for the people who just can't breastfeed or the babies who can't breastfeed.
Right. And one of those is a seed oil.
Right.
Like,
which is an important part. For babies' brains to grow, we need fat, and oil is a really good, safe.
And the linoleic oil, or linoleic oil, however you say it, but is actually a really important part of formulas, because it is the one that actually is very similar to the one that we give our babies. And if you don't have that, your neurons, like it actually kind of coats the neurons that are growing in the brain, and you won't have enough of that. And
we need neurons.
Your brain can't grow. Like literally, your brain can't grow without it.
Myelination is important.
Myelination is super important. So it is really, really important that you do that. And I know with some of, again, what's out there and
it's confusing sometimes.
Misinformation that can be out there, they support like do-it-your-own formulas, and that is not what we recommend. Do-it-yourself formulas can very much lack things that are super important in formula for babies, and for their growth, for their health, for their brain growth, all of it.
Safety. And so, yeah, human donor milk is excellent too, especially we have to make sure it's pasteurized. And in the beginning, that may be a good supplement if you don't have enough breast milk, but formula is a very safe alternative.
It is a very safe alternative. And we do have the human donor milk at Providence. And that is, and there are some places you can get online. Again, just making sure that it has been screened for any infections, and that it is also pasteurized.
Yes. So what comes as a point of feeding is peeing and pooping. That's the next part, right?
Yeah.
And it was kind of funny because, as adults in general, we don't really talk about poop. But as you become a parent,
well, as pediatricians, we talk about poop all the time.
Let's say as a parent, you talk about poop all the time. All the time, you're like, what color was it? How many times a day? Like, that's the conversation you seem like you always have over a meal for some reason, right?
Yes.
Well, I don't know what that is. So just get used to talking about poop if you're having a baby.
That's right.
You will a lot.
And pee, poop and pee. But the poop, like basically, initially starts out as this black, really tarry, sticky stuff.
Definitely put some gloves on to change that diaper.
Yeah,
it's real sticky.
It is really pretty darn sticky. And as baby feeds more, that transitions, and it transitions often to this like greenish, brownish, and then or even orangey, and then to a yellow seedy stool.
Yes.
And they can have a lot of poop again. So as you're really getting your milks in, or they're feeding well from formula, all of a sudden they go from like not having as many poops to having a lot more poop.
Every time they're eating, they're having one or two poops.
Yeah.
Right? And I always call them stealth poops because you don't even really smell them. And unless you hear the explosion, you don't even really know they're in there. And you open the diaper and you're like, oh, wow, that's a lot of poop.
But it is good to anticipate them because they almost poop every time, like as they're really going, and especially in those first 2 weeks or the first month when they're being fed really well, they will poop maybe every time they eat. So now the difference is that they're pretty loose, watery poops.
Yes.
But often they're not big, and that's the difference between diarrhea and your normal breastfed poop. Your normal breastfed poop will have little tiny squirts sometimes, and then these big ones, whereas diarrhea will be big all the time.
Every single one, yeah.
And so the other thing I always tell parents is that expect those little squirts and those little squirts can still be irritating to this beautiful newborn skin.
And you don't even know they're there sometimes, and they just kind of burn the bottom a little bit. So it's a good idea just to start, when they're pooping all the time, like 12 times a day, just put a little bit of diaper cream right on the crack, on the gluteal crease is what we call it. And it can be either like a zinc base, like the thick
That's
white
my favorite.
stuff. That's your favorite.
I know.
Or I like the A&D or Aquaphor Vaseline. Just to have literally a layer between the poop and the skin.
Yeah, and it offers just a barrier. And then you can just wipe off the poop. You don't have to like scrub everything down, but wipe off the poop so that you're not really irritating the skin more every time you have to change a diaper. So
yes, and little girls, they have a lot of things going on down there, like some discharge sometimes, some thick stuff down there. You don't have to wipe it off all the time.
No.
Like wipe off any little speck of poop you find, but all of that, I always call it the protective layer, is trying to keep normal bacteria there. And so after they have a few baths, it'll come off, but at the beginning, just you can leave it there.
Yeah. And then peeing. So, and before you leave the hospital, they will have to both pooped and peed. But then they should pee about 1 wet diaper for every day of age. And again, this is because they initially don't have a lot of extra fluids, and then as they start eating better, they should start having more fluids and pee accordingly. And so, at 5 days of life, they should have at least 5 wet diapers. If at 5 days of life they have 2 wet diapers, that baby really isn't being fed enough.
Feed the baby.
Feed the baby.
Right. That's what we need to do. And then around 7 days, you should be like, wow, I can't even keep track of how many wet diapers and poops there are. And now you're like, success. I don't have to keep my little chart anymore.
No more charting.
Yes, we know what's happening there.
So, and that's your thing. And then we talk a little bit about skin and skin cleaning. We talked a little bit about the diaper rush one, where you use the ointment. The one thing I talk about skin cleaning is that, again, they go from this really wet environment.
They were in a bag of warm water.
They were. And they weren't actually turning over skin cells, which is what we do all the time. And so all of a sudden they come out, they dry out, and then they turn over that whole first layer of skin cells. And so they really do kind of flake and have dry looking skin. That's normal for all babies. You do not have to worry about it. It doesn't mean your baby's going to be really dry forever.
No, and I always say they have to shed a layer of skin, like a snake, right? Like it's got to start again.
Get all of that the old stuff that was inside where they were in the water
and
off.
Grow new skin. And you don't need to put any lotion on it, but you can just use a wet washcloth to wipe off any crusty parts.
Yeah, and then the other thing is make sure you get into those in between areas. I swear, under the arms, in between the little inguinal folds, which is just where the leg comes up onto the diaper area. It can be little areas that gunk can hide, right? Yes. And that gunk, if you leave it there, will get smelly, and also it'll irritate the skin a lot, and you can actually break down the little baby skin a little bit. Yeah. So definitely get in those nooks and crannies.
Like a nice soft washcloth,
warm water. That's all you have to use.
That's all you need. And then you can have a real bath after the cord comes off, and then that kind of gets turned over a little easier.
Yeah, and we did talk a little bit about vaginal discharge, but I also want to talk that one of the other common things that you'll see on the skin is some breast hypertrophy. And both vaginal discharge and breast hypertrophy.
Their boobs get kind of big.
Yeah, their boobs get kind of big. And this is boys and girls. So it has nothing to do with them. It actually has to do with
getting rid of the mom's hormones. So they have to kind of shed it out of there.
It's a response to maternal hormones. And it actually can get kind of big and sometimes even have a little milk production, which I know is disturbing, especially for little boy parents. We're like, what? But it can happen.
Normal. Just turning over the hormones.
They're just turning over the hormones. The only time you have to worry is if it gets really red, hot, or painful, because those can indicate an infection, like even a mastitis, women have. But it's pretty rare, and the breast hypertrophy itself is normal.
Super normal. Because they were in a bag of warm water, when they get out, babies are not very tolerant of temperature changes and of things being too loud and bright. And so for the first week or so, and when they're really sleepy, if you want them to be more awake during the day, sometimes take them into a dark, quiet space and they'll wake up a little bit. And sometimes at night, so you get them to sleep, you make it loud and bright so they'll actually go to sleep. And then, again, babies can't adjust their temperature very much. And so what we say, try to keep your house about 70 to 72 degrees, so they don't get too hot or too cold. Babies cry.
Yeah.
I mean, it's communication. Like, that's how they're trying to tell us things, right? And at the beginning, they don't differentiate their cries as much. By the time they're at a month, you kind of like get the idea of like, this cry is hunger, this cry is bored, this cry is gas, whatever. At the beginning, the cry is pretty
Just there.
similar. So I always say, if they are crying and it's been less than 2 hours since you fed, just check them again. Are they too hot? Do I need to change the diaper again? Do I need to burp them? And if you can't find anything, you're like, fine, I'll feed you. But sometimes you had a great feed and you're like, I just need to soothe you.
Right. And there's different ways to soothe, but I really like the Happiest Baby on the Block. It came out after my kids were there, so I didn't use it. But
you kind of did them already,
did a little
though,
bit,
right?
a little
Your
bit
mom
of it.
taught you how to do these things.
Some of them. But they're called the 5 S's. And the first one is swaddle, which means you do the little baby burrito wrap, right, with a thin blanket. Then you kind of put baby on their side. You have them suck, which can be a pacifier, right, which works really well. And like we said before, pacifiers are totally okay to do that. And then you kind of shush and like sway, right?
Yes. Or
Shush
sing
and
if you're
sway.
you.
Or sing. I sang, but
Yeah.
but you can like do those kind of things. And those are the 5 S's, and those absolutely work for soothing a baby and also often for like colicky type symptoms. And we aren't going to talk about colic. Again, it's something that we could spend a whole episode on, colic in and of itself. But these can be really helpful if you're getting that first baby to calm a little bit and soothe. The other thing I always talk about is that if your baby's crying, they're breathing, right? So if you've done all of these things and your baby is still crying, and now you're like, oh my God, what am I doing? And you're starting to get anxious or worried. That's a time actually to let baby, put them in their bassinet, and again, where they're safe and healthy, and nothing can get in their face or cause any problems. If they're crying, they're breathing, you're hearing them, you're listening to them, go get a drink of water, calm yourself down. And then often when you come back, you are more able to calm your baby.
Yes.
And that is really helpful, because when babies are screaming, you tend to get anxious, and soothing a baby when you're anxious is hard.
They can feel you tensing up. And a lot of those situations, the baby just needs to pass gas. So you lay them down there and walk away, they pass gas, they feel so much better. And so like, good job, babe, you got the gas out.
I guess we can talk about gas then.
Yes, so gas is super normal. I mean, babies tell us when they have it a lot. Either we can hear it or we can just see them having a hard time trying to pass it. And it's a normal part of swallowing air. So because they're crying, they're swallowing air. Because they're feeding from a breast or bottle, they're swallowing air, which is why we burp them. Right. But sometimes the burping doesn't get it out enough, and then it's going to come through as gas.
Yeah, and there are things you can use for gas too. Like I like simethicone drops or the myocon drops. The reason I like them is because they actually don't get absorbed. They just help you form little gas bubbles and get tooted out or burped out.
I like tooted.
I know. I like a little toot sound.
I know, it's like a good sound.
But yeah, anyway, that can kind of help them feel better. There are lots of other options, but it is important to know what's in the other options. So, and making sure that there's nothing that could harm the baby.
And most of it's just mechanical, right? So like I say, we talk burping, and I like them at the beginning of the feed. You can kind of see sometimes they're going fast, and all of a sudden they kind of open their eyes. You're like, slide them off right then at the bottle or breast. Kind of bend them in a C, rub their back, or kind of pat their back.
Yeah, I like the
so you have to put them in like a little boat and
let them get the air out.
But at the beginning of the feed is kind of when they screw up the most, because they're just kind of like the milk's coming fast.
Yeah, and so we do talk about different things that happen for babies, like hiccups and sneezing and congestion and noisy breathing.
All normal.
All very normal. All very common. If the baby hiccuped inside you when you were pregnant, that baby is going to hiccup outside. Yes. Sneezing, again, very normal. And it doesn't mean they have allergies. It doesn't mean there's any problem.
And it's really because their mouth is this close to their stomach, so sometimes they just reflux. do this little thing, and it comes up their nose and comes back down, and then they form mucus in response to that.
And I feel like this is a question I get a ton in the clinic is my baby's congested all night. And again, that reflux is often the culprit. Every baby refluxes, so every baby will spit up. Some really spit up a lot. It comes out through the mouth. Some actually just goes into the back of their oropharynx area and causes that kind of congestion
And they can even
noise.
spit up through their nose. And I think that freaks people out, but it's your mouth and nose are really close together.
That's
actually mean it's worse.
That's why they're connected, and that's why they get the congestion, noisy breathing, right?
Right.
And so suctioning can be helpful if it is causing a little irritation, if it's waking him up.
Or waking up.
And I always do suctioning with saline. So always do a little drop of salt water.
You can do like a little baby saline that comes in tiny little bottles.
Yeah, I kind of like the drops better just because I feel like the sprays are like, bleh. Anyway. But it's just like all in their face.
Yeah.
And you can use the little bulb or the nose Frida. I won't ever show you the nose Frida because I'm never gonna suck some snot out of another baby nose.
Kid. You totally did saline and used the nose Frida on my baby.
Well, your baby's different, but for most children, I'm not gonna do that in the office. But I will show them how to use the bulb, and the bulb is so helpful and it is great for when they are congested and having a little trouble.
The other thing that parents ask a lot is about the weird breathing patterns that babies do, especially when they're sleeping, where they do this little, and they go, and it's super scary if you listen to it. You're like, oh my God, they're panting. Oh my God, they're stopping breathing. Totally normal. Their brain/diaphragm is just learning how to work. So this kind of breathing is happening when they're sleeping and they just seem content.
Don't worry about it. So what about also one of those things like what happens when feeding goes wrong?
Yes, so choking is super common with babies, and every now and then, it kind of can happen, no big deal. But if it's happening a lot with a feed, then you need to talk to your doctor about it.
Right.
And I feel like most of the choking happens either right at the beginning of the feed or right at the end of the feed.
Right around 2 weeks when your milk is fully in and you've got a lot of milk there, all of a sudden you go from when that baby was really having to suck pretty hard to get everything going, and then they suck pretty hard and then you let down and literally it's like a hose that opens up. Yeah. And the baby's like, oh my God. And he's trying to suck and swallow as fast as he can and typically choke. Sometimes they can even turn a little blue when that happens. It's really scary. And it is absolutely still normal. One of the things you can do is really watch as your baby as you're feeding. Some moms can actually feel the letdown, and if you can take the baby off before they get the full letdown, and you can just hold for a second, that'll help.
Squirt them directly
in the face. And that can help. It also gives them a moment to catch their breath.
And never normal to be blue on the lips, but sometimes they do get blue on their hands and feet.
Yes.
And again, that's their body learning how to spread blood to all the parts of their body, and they don't do it real well. So if they have blue hands and feet for that first 6 weeks, it doesn't mean they're cold. It just means that they're not doing a good job at it.
They're just not getting all the blood supply where it's supposed to go yet, and that's okay. It's not going to hurt those hands and feet.
No.
It's not going to cause any problems. However, if you ever notice blue in the lips or in the mouth, that is a problem, and again, it needs to be seen right away. And then vision, babies don't see well.
No.
They are very blurry. They cannot see very far away. They're really nearsighted. They see all in black and white. And so a lot of times that's why they're not clearly looking at you. They do notice your face and they absolutely can understand your voice and recognize your voice. But it is why as their vision gets a little bit better, a little bit clearer, every week, by 6 weeks, they actually start to have that responsive smile. And it's because they can fully clear your face.
Oh, that's what you look like.
And look at that person's doing that with their face. That must be good, right? So don't worry if that's happening and they're like, why are my baby's eyes crossed? They're supposed to be. They're not working
really
together. Right.
So people ask us about circumcision quite a bit, and that is really a parental preference. There are some medical reasons circumcision has been recommended in the past, but they are very slim, and really at this point, it's again parental preference.
And then we talk about fevers, and fevers is actually one of those really important things. We did talk a little bit about heat and wrapping too much, because sometimes then you can have a little warmth. But if your baby, if they are feeling warm, you do need to check their temperature, because fever in an infant
It's a big deal.
is a big deal.
Yeah, and trust your instincts. We know you kind of know that baby within the first couple 3 days what the temperature feels like to them. So if they feel a little warm to you, then check their temperature. And we recommend like just a little digital thermometer that's a quick acting digital thermometer.
Fast, like you want
Fast.
less than 5 seconds.
Because they're not very patient.
And you are not either.
No. And so if they feel a little warm to you but not acting too weird, it's totally fine to do a screening temperature under the armpit. And if that is 100.4 or above, you need to check it in their bottom. You need to check it in their rectum.
And it's just, you just put the little metal portion just in the bottom. And again, you're holding it for less than 5 seconds. It is not going to hurt the baby. And you can check. And if that temperature is 100.4 or above, it is actually an emergency. So you have to go to the emergency room and get your baby checked out.
And the deal is just babies can't show us a lot of things. So if they have a fever, we have to assume it's a big deal because they don't really have any other ways to show us anything. And when you get to the hospital, they're going to do an evaluation and to help us figure out, is it a big deal or not?
Right.
And so that's that first 6 weeks. So we don't give any Tylenol to babies in that first 6 weeks because we don't want to hide that fever.
Right. It really does. We say this a lot, but it takes a village to raise a child.
It does.
And it really takes a village to have a newborn. And if you really, it's so important to recognize that people want to help you and they really want to be involved and make sure that everything's going okay for you.
Yeah, and give them specific things to do, right? I mean, a lot of times it's just really hard to take a nap with a newborn in the room because they're just not quiet. They're always making little weird noises and breathing weird, whatever. So just have someone come over for an hour so you can take a nap in a different room.
Or
like,
a shower.
Or a shower. Like, please just
Showers are so important.
Sit with my baby. But, you know, just have people come over, bring you food, do your laundry.
I said, like, my mom was, the best thing my mom did when I had a baby was that she fed me. And we forget to take care of ourselves when we have a newborn because you're feeding that baby every couple hours and you're trying to sleep and do everything in between. But also they're pooping and they're peeing. And so you're changing them and then getting them back to sleep. It's like so much time and you're so stressed about everything that often you forget to take care of yourself. And that's where those people that can help you are so important. Let them help you and do never feel guilty. Again, you'll have tons of stuff to feel guilty about. All their lives, you can feel guilty. Do not feel guilty about taking help or feeding them. Feed the babies.
Feed the babies.
Like
we can talk about babies all day.
And I think we did. But anyway.
All right. Well, I'm Dr. Joanne Smith.
And I'm Dr. Corinna Hankins.
Thank you for listening. Oh, this is
a Podful of Pediatrics. Thank you for listening. And hopefully this will help you keep your newborn safe, happy, and healthy.